This talk is about how to organize your thoughts around differential diagnosis in psychiatry. I'll teach you how to think about a differential diagnosis with a visual organizer. The first step in creating a differential diagnosis is determining the presenting symptom. Though this is not comprehensive, a simplified way of categorizing common presenting symptoms in psychiatric practice is depression, anxiety, mania, psychosis, and confusion. Starting with depression, let's walk through an example differential diagnosis. For every psychiatric symptom, you'll first want to consider and rule out medical-related or substance-induced causes. For example, for depression, one medical cause is hypothyroidism, and one substance-induced cause is chronic alcohol use. Before considering major psychiatric diagnoses such as major depressive disorder, bipolar disorder, or schizophrenia, you'll also want to consider the context in which the symptoms occur, and consider whether a self-limited, context-related disorder is more appropriate. Such disorders that commonly present with depressive symptoms include adjustment disorder in response to a major life adjustment, demoralization in response to a chronic or debilitating medical illness, bereavement in response to a significant loss, or a trauma or stressor-related disorder. If medical-related, substance-induced, and context-related diagnoses have been ruled out, then you can consider a primary psychiatric disorder. For depressive symptoms, these would be the mood disorders, including major depressive disorder, persistent depressive disorder, and the bipolar disorders. You should also consider personality disorders and more generally how a patient's personality traits contribute to their symptoms. Diagnosing personality disorders is complicated and goes beyond the scope of this talk. Now that we have a general framework for how to work through a differential diagnosis, let's apply this framework to the other presenting symptoms. As before, first consider medical-related and substance-induced causes, such as those displayed here. For each of these presenting symptoms, there are many other medical-related and substance-induced causes, and I would encourage you to review these causes and develop your own framework for systematically ruling them out. For anxiety in particular, it's important to determine if anxiety is limited to specific contexts. For example, if anxiety was solely related to social settings, this would point more towards social anxiety disorder rather than generalized anxiety disorder. Also, anxiety is often a symptom of depressive disorders, adjustment disorders, and trauma or stressor-related disorders. Psychotic-like symptoms as well are often seen in trauma or stressor-related disorders. Finally, as before, if medical-related, substance-induced, and context-related diagnoses have been ruled out, then you can consider a primary psychiatric disorder, such as those displayed here. I hope that this framework will be helpful for you in systematically working through differential diagnoses in psychiatry. One take-home point I would like to emphasize is that psychiatric disorders should be considered diagnoses of exclusion. That is, they should only be considered once other possible etiologies have been ruled out. Thank you.